Okay, thank you so much for joining us. My name is Jen Killian. I'm now a lieutenant MSO, field supervisor for medical with East Pierce Fire and Rescue. And this is the 5th class that we've done in this 6-session series. Really valuable stuff to help us all as we prepare, whether for ourselves or a spouse or a parent or loved one, as we move into aging and look at how we can help better support our older population as they age. This one particularly kind of hits close to home. I know it will for you as well, Larissa. Caring for the caregiver. I've got 2 parents with Alzheimer's and have been in a caregiver role with them. And I know how hard it is. I know Matt has been in his own life as well. And it's tough. As caregivers, we need to take care of ourselves as well so that we're better able to care for others. In the fire service, they tell us, that we have to make sure that we're alive before we can help save other people. So you got to take care of yourself first. With no further ado, I'd like to introduce Matt Santelli with Pierce County Aging and Disability. Matt is an outreach and education specialist and is just an extraordinary wealth of knowledge from both personal and professional experiences. So we're super fortunate to have him here to share how we can best care for the caregivers in our lives, including ourselves.
Great, thanks, Jen. Appreciate that. Appreciate everybody tuning in. Appreciate those of you here in the building. My name is Matt Santelli. I work at the County Aging and Disabilities Resource Center. At the end of the discussion, the last slide has information about follow-up resources, and I'll kind of bring some of those up as we go along. And you can always call our number, which will be showing there for more information. We also have a public meetings and events calendar, which will be shown on the last slide. And we can get that PowerPoint sent out to you if you request it as well. We talk this particular talk as a hot topic series because we're always adding information to it, so it's always changing. That's why we call it a hot topic. And we call it Caring for the Caregiver because we're really trying to look at self-care and supportive care for caregivers. We specifically have a program, our Family Caregiver Support Program, which is really focused on relief, help, and support for family caregivers, and we'll talk more about that later. When I always give this talk, I always give the disclaimer that we want to make sure that we're not giving an exhaustive list of every situation you might be experiencing. Jen has experience, she'll chime in. I have experience in our own families providing care, and we see that care situation when we're doing direct service with our clients as well. We always want you caregivers to support, find support, talking to their physicians, family members, other trusted individuals to develop your own plan of self-care when you're in that situation. So when we determine who is a caregiver, and it sounds like a simple question, but sometimes it's not. So we're going to be considering unpaid family and friend caregivers. One of our Medicaid programs, the COPES program, actually allows certain family members and friends to be paid as caregivers. There's pretty strict income and eligibility requirements on that. Caregiver is the one giving the care, the care receiver is getting the care. And that definition can change over time as family dynamics, economy, longevity changes. That family caregiver support program that we have used to really be focused on the client receiving the care. So we would do a full assessment on that person. Now it's really focused on the caregiver. It's really saying, here's a caregiver that's reaching out for help, needs some support in the home, needs some relief care, whatever the case might be. So we really shifted the focus on that to give the caregivers a voice rather than the caregiver just being a person who's kind of surrounding the person needing care. So that's why we give these talks. We're really trying to emphasize what caregivers' roles are and how important it is. Technological changes that we think often in our own personal lives make things easier, often makes things much more difficult as caregivers.
I think you need to advance forward maybe. That's what we're hearing online.
Maybe it's not tracking.
Try it again.
Okay. I was on this one.
Oh, okay. I thought you were still on the disclaimer. I think that's what it had looked like. You may have accidentally hit back instead of forward.
Okay, got it.
Yep.
So this is why we're, okay. So I was on definitions of caregivers. People got that?
We're good now.
Okay, great. And so giving care as a caregiver can define in many different aspects, and we'll talk about that on the following slides. Because when I was doing family caregiving for my parents, my uncle, a lot of it just had to deal with figuring out technology for them. setting up automatic bill paying, checking accounts online, all of these things that we didn't really grow up with. Now you kind of have to become an expert with when you're in a caregiver situation.
You know what, Matt, hang tight. I think it's not sharing the right window.
Okay.
So let me.
I ran into that.
Yeah.
So what I was seeing in my
I
screen.
think that is the problem. So let's try this. All right, that looks much better.
Yeah, I had that come up recently. I was trying to host an event. Yeah, what I was seeing on my screen was not showing what people were seeing.
Yeah.
So took a little trouble. So.
We are good now, and we will have a copy of this PowerPoint uploaded to the website as well, right. So you'll be able to go back and refer to it.
Excellent. Good. Okay, so when we think about caregiver duties, we have a whole program that we have and public relations campaign about I'm a caregiver, because it's always trying to define for family members that the roles you start to take on means you're a caregiver. Now, we ought to think of ourselves as a husband, a wife, girlfriend, boyfriend, son, daughter, but we also have to think about what does that mean in terms of what we're doing, because then it leads us down the road of finding support that we might need. So those caregiver duties, like I said, managing finances, paying bills, filing taxes, shielding against financial scams. This is a huge one that we hear from families all the time. Mom or dad got in trouble, they talked to someone on the phone, or they talked to someone who came to their front door. They responded to a sweepstakes mailing or an email that they shouldn't have. These vulnerabilities are really brand new the last 10, 20 years that we really didn't experience back in the day. And now are really, really obvious in the struggles you have as a family caregiver. Online platforms for bank accounts and investment accounts, tax filing, all of those things. Again, this is something we didn't have to deal with before. Passwords and things like this. I talked to a lot of family members who said, oh my gosh, everything that mom or dad set up was online. We don't have their passwords. We don't know how to manage any of these accounts. We don't even know what accounts they have open. So this is another responsibility that's new. And then of course, things like groceries, household items, scheduling transportation. This is another big one. We have a lot of family members who will come to us and say, mom and dad isn't safe to drive anymore. What do we do? There is a process by which you can send a referral to the state patrol, where they will go ahead and request that the person retest. But we've also found that people go in, they'll retest, like my parents, both failed, lost their license, and both kept driving. So then it became a matter of where are the keys? They've hidden some keys, and so that's a big issue, because generally loss of driving privilege really feels a hit to their independence and autonomy, and then they need some sort of substitute. And so you're often going to be that substitute then. Housekeeping services, including yard maintenance, furnace, plumbing, electrical maintenance. I did a ton of work with my parents, just maintaining the household, because my mom couldn't figure out if things were wrong anymore, or if it was just her memory. So I was constantly kind of inspecting plumbing, electrical, faucets, furnaces, all these things to make sure they were functioning properly, because you want to get ahead of those problems. Vehicle maintenance and cleaning, installation of supportive medical equipment at home. Very early on with my folks, I suggested we do grab bars, ramps, all these things. They were very unhappy with them. And honestly, of the grab bars and things I installed, the ramp they used because they had to, it was coming up their front porch. They didn't have a choice there. But of the grab bars, I think the only time very late in my dad's life when I would help him shower, he understood the necessity of the grab bars in the shower. But the ones I put surrounding the toilets and things, forget about it. All they did was hang bath towels on those. They never used them as grab bars. So despite your best efforts, things might still not work the way you want them to, but you still put the plan in place. And then prompts and direct assistance for personal hygiene, dressing, bathing, toileting, foot care, medication management, meal prep. All of these things go into providing care to a family member. Okay, even more duties. Understanding things like Social Security, retirement, disability, understanding Medicare, Medicaid. And again, this is a brand new world for many of us, because back in the day, all we had was basic Medicare, and then we added prescription drug coverage to it. Now we have a choice of all these different Advantage plans. So right now we're starting Medicare open enrollment. It goes from October 15th to December 7th. And folks on Medicare are bombarded with mailings, radio ads, TV ads, all about making changes to their plans. There's 73 different Advantage plans available just in Pierce County alone that people can choose from this time of year, change back and forth. This is incredibly confusing because there's unscrupulous actors that send stuff out too that mislead people into thinking it's an Advantage plan choice when it's some sort of scam. So this is a big deal now that didn't used to be so much anymore. Locating, understanding, filing durable power of attorney forms, protective pay forms, advance directive, post forms, last will and testament. This one comes up with our clientele all the time because I do a whole class on legal documents that I think we have posted on the website.
We do.
But we have many clients that do the documents, never tell anybody, put them in a cabinet somewhere, and then when they're needed, nobody knows where they are. We get calls like that all the time from families saying, we think there was a will, we think there was a financial power of attorney, we don't know where it is, what do we do? And those documents have to be completed before a person begins their decline. So they need to be done while the person is of sound mind and can tell a notary in front of them, yes, I understand these documents. Emotional support, companionship, did a lot of that with my mom and dad, just comforting them, especially with my mom when she was in decline, taking them to church, having meals together with them, entertaining them with TV, sports, all kinds of different things, taking walks, faith services, and then making sure they had their vaccinations this time of year. So that's just a simple list of caregiving duties. It gets much bigger than that. Any questions, comments on that so far? Seems to make sense, I would hope. So how did I know that role had changed for me, becoming a caregiver for my parents? It changed for me when I knew that I was no longer doing things I wanted to do with them, and instead I was doing things I needed to do for them. So occasionally, my mom had various medical appointments. I would sometimes go just to kind of stay on top of things. But back in those days, it was, Mom, when's your doctor's appointment? I see you have it on the calendar, 10 o'clock on a Tuesday. Okay, I'll take that morning off. I'll meet you there at the doctor's office. She would drive, I would go in. I didn't have any doubt that she understood what I was telling her. And then when my mom and dad went into their decline, then all of a sudden it was like I was scheduling the appointment to work with I'm in my work schedule. I was making sure I would get to the house early to get them showered, dressed, ready to go, get them into the car, take them to the doctor's appointment, take notes, so I knew everything that had to happen, typically stop at the pharmacy on the way back, bring them back home, have lunch with them. So that one time, I'll meet you there every now and then, became, this was my day. You know, I had to substitute a whole day to take care of them. And that's what I mean, moving from things I wanted to do with them to things I needed to do for them. Any comments on that, Jen?
No, I mean, when my dad was first diagnosed with dementia, his minister actually gave me a book about caring for adult children, caring for their parents. And one of the biggest things that it said was, you can either be a caregiver or you can be a daughter, but you can't be both, at least not at the same time. And I have found that with both of my parents, that and part of it is the dementia, but when I walk into the situation as their caregiver, there's friction.
Yeah.
But if I can find a way to be like with my dad, we'll try and play a game of cribbage first if we can. And then we can get into some of the, let's look at your accounts and make sure everything's going well. Like, I've got to set up that relationship as daughter first, and then I can move into some caregiving responsibilities. So sometimes you have to find that balance.
Absolutely, yeah, and it's tricky. I remember once my dad had an upset stomach for some reason, and the bathroom became quite the mess, as you can imagine. And I got showered, I cleaned up, and then he got sick again. I had to shower and clean up everything again. And I remember before I left that night to kind of settle things down, he said, "Oh, when will I see you again?" I said, "Well, I'll stop by after work tomorrow." And he said, "I'm really starting to worry who's going to take care of me as I get older." And I was like, wow, I think I just spent several hours taking care of you. But in his view, I was just his son helping out. I wasn't providing caregiving duties. And so that's a perfect example like you're giving. You kind of shift back and forth in those roles, and sometimes you have to be very stern and setting limits and making sure things go the way they want to. And over time, as the decline becomes more pronounced, it becomes more and more difficult to have that son or daughter role versus the caregiving role, because it's so foremost in your mind that you're a caregiver rather than just the son or daughter. So yeah, good point. Yeah, thanks. Okay, by the numbers, millions of people provide support and care to ill or impaired loved ones. We have clients in our family caregiver support program that are sons, daughters, moms, dads, People can get disabled at any age, so oftentimes you'll have a husband or wife caring for someone even who's very young, that's in an illness or injury kind of situation. 1 in 5 American lives with a disability. That's 22% of the population. 13% with a mobility disability. Close to 11% have difficulty with things like dementia, concentration, memory loss. Difficulties with independent living. Almost 5% are blind or nearly blind. Almost 4% can't do everyday tasks like bathing, dressing. Caregivers are really needed more than ever before. The fastest growing group in our age group population is that are 80 and over. We're not really seeing the replacement numbers we need in terms of people dying in the US and people being born. I think we're just at replacement. Around the world, most countries in the advanced world are under replacement level, meaning their people are being born aren't catching up with the people dying, so their populations are in a slow decline. So one thing we're seeing in the community is that we're getting fewer and fewer opportunities where we have reliable professional caregivers at service agencies, and they can't keep people employed. So when someone calls us, in most cases, we can staff something. It's very difficult if we go into more outlying areas. There's certain parts of the county like Ashford, Roy, Anderson Island, places like that, where we just don't even have availability for caregivers. Pierce County is 1,600 square miles, and so that's a lot of territory to cover. And there's people that live in every nook and cranny, so it's harder and harder to find professionals that are available to do the caregiving job. And that's why we really try to support the family members who are caregivers. Unpaid caregivers make up almost 44 million people in the United States. Amount of people in those roles continue to increase. 34 or some million Americans will be taking care of someone 50 or older. And then you overlay things like dementia, Alzheimer's disease, et cetera. That's close to 16 million family caregivers. Caregivers vary in age more than the recipients. And this is an interesting statistic because this kind of grabbed me right in the time I started to do the caregiving. 48% of caregivers are in that 18 to 49-year-old group. Only 14% of people needing care fall into that same range. The average age of a family caregiver sits at about 49 years old. And that's right around the time when my parents kind of started to have noticeable signs of decline. And that's when I started to really aggressively start intervening in their lives more to keep them healthy and safe at home. So that was right on the money. And my wife was right around that time as well with her parents as well. Gender, women more likely to be caregivers. I would say that most of the time when we get calls from families about someone needing care, it's usually the woman, not to be gender stereotypical, but usually it's the woman. They make up about 75% of all caregivers, and female caregivers spend up to 50% more time with their care receivers than male caregivers do. We were fortunate in my family. I was handling most of the financial stuff, and my sister would come to the house because she wasn't working at the time. She was pretty much there every day. She'd do lunch with my folks. She would do dinner for them. And then we had some nieces and nephews that would spend the night with them. We had a couple of nights where there was a professional paid caregiver there. But even so, most of the time when we're getting requests for caregiver help, it's generally coming from a woman in the family. And that even is true for just the other day, a friend of the family, it was the husband's mom who lived with them. But even so, it was the wife, in other words, the daughter-in-law, that called me about care for her. So that's not unusual. So that's just kind of a recognition of the great caring that women in families provide to the families at large, really, over time. Race, Latin Americans more likely to take on the role of caregiver compared to other groups. 21% of caregivers are from that community. African Americans, similarly, about 21%. Asian, about 20%. White Americans, about 17%. So one thing we're always doing at our office is trying to reach out to those underserved populations and with other origins, because we try to make sure that we can attach them to caregiver support as well. And then an LGBTQ community as well. Male caregivers, about 41 hours spent in their caregiving roles in comparison. Heterosexual men, about an average of 29 hours. So again, that's a group we try to reach out to as well to provide caregiver support. Next.
You've got it.
I got it. Thanks. Challenges facing caregivers. Okay, so this is where we really focus on the care needs for the caregiver, because The number of older adults needing care is growing. Like we said, that 80 years and older group is the biggest group. Half of the caregivers that call us in families are employed. So again, they're having that choice of taking time off from work or giving up work altogether to provide care for that family member. And like I said, fewer and fewer people are available professionally to do the work. So we have more and more family members coming in to do the work. And that's true not only for home care services we're looking for, but also for care that happens in assisted living facilities and adult family homes and things like that as well. It really does take a toll on physical and emotional and mental health. Between 40 to 70% of caregivers report some level of significant depressive symptoms. Anxiety and depression are prominent among caregivers, especially when it comes to someone who might be memory impaired, confused due to a dementia process or a stroke or a head injury, anything like that. 34 to 40% of caregivers experience strong emotional stress levels when they're caring for someone with dementia. Physical health can decline as well.
Sorry, it's the slides are getting kind of skewed, but yeah, it's good.
And then one of the things that we try to always help people out, you can always call us for guidance on this, is understanding and preparing for long-term care planning in the home or facility care. So that's understanding what an agency does and what it provides. What's home health versus home care? What can a doctor order versus what you can request? What kind of assistive devices are there for safely showering and grab bars and ramps and things? There's an outlet called the Alzheimer's Store online, which has a bunch of devices that you can use for somebody that's memory impaired. Everything from door alarms to trackers you can put in somebody's shoes, to devices to make sure that the faucets don't flood out a sink, all kinds of things, to various motion sensors that turn off a stove if there's not activity around it. My mom, for example, left a pot on the stove that burned up. It burned up the fan overhang. It burned up the cabinetry. I mean, it was surprising the whole house didn't burn down. But that was a good final clue to me that I needed to be in there more aggressively and have a monitored smoke alarm system and all kinds of different things. So that's just one thing. How do you equip the house for safety for someone in a long-term care planning situation? And then the financial long-term care planning, how do you qualify for Medicaid and things like that? And then understanding, again, what relief care is available, what services might be available for housework and errands, understanding medications and interactions and things like that, all kinds of things that go into long-term care planning. Okay, I'm going to take a break there. Any questions so far? Anything we talked about, comments?
If anyone has any questions online, feel free to unmute. If you're not able to, let me know, or you can type questions into the chat.
And like I said, one thing that's gotten so confusing is just the Medicare world, because there's all these different Advantage plans and people get confused about what they do. Medicare itself does not pay for long-term care. It pays for short-term home health or rehabilitation in a skilled nursing facility. Otherwise, we're looking at services we provide for in-home care. Not all of them are Medicaid funded, like family caregivers, just based on income. And then we look at possibilities if a person needs to go into assisted living, adult family home, or a skilled nursing facility. Okay, let me give two examples that I've dealt with over the years of caregiver situations. I encountered a mom caring for 3 adult sons, all of whom were mentally ill, all 3. At age 62, she became ill very quickly and died, failing to manage her own health, basically devoting herself full-time 24/7 to these 3 sons. After months of struggle trying to keep them living on their own, we ultimately had to get them placed in different group homes. So this is a situation where ideally she would have reached out to us long before all this happened. And unfortunately, she passed before we even encountered this family. And the only reason we found out about them is because the apartment manager where we lived let us know that, as far as she knew, the mom wasn't in the apartment anymore. She didn't even know the woman had died, and that these 3 gentlemen were there, and they were constantly asking her and the neighbors for help. And so it was a really dramatically sad situation. Another one, a husband needing cancer treatment. He was caring for a disabled wife and disabled son. He became ill from cancer, could not undergo the treatment while caring for himself and them. He called us, and so we were able to get some help in there with the support also provided from the cancer treatment team. arranged for my wife to move in an adult family home. Husband survived, and so he was able to continue to live at home with their son. So that was kind of more of a success story than the first one. Overall, however, anywhere from 30 to 70% of family caregivers die before the person they're caring for. So that's a pretty dire number, and especially in husband and wife cohorts 60 and over, we often see that the husband and wife, being the caregiver, become more and more ill, isolated, worn out, and their health problems start to catch up with them. And then again, we have those tragic situations like the first example where that husband or wife ends up sick or in the hospital, nobody's there at home to care for their spouse. And I'm sure you see these situations all the time.
We do. Yeah.
Very tragic. So this is why we have presentations like this. This is why we try to extend knowledge into the community that we do have support for family caregivers in a variety of different realms, where we can provide in-home support, we can provide some housework and errands help, we can provide caregiver support groups and guidance, all kinds of different possibilities to support that caregiver so they don't go into physical and mental decline due to the overwhelming stress of the work they're doing. Okay, so jumping into how do you make it happen? First thing you want to think is safety in the home. Okay, so I talked about maintaining the home, making sure the heating and cooling systems are all properly maintained. We actually had to put a safety cover over the thermostat because my mom over time couldn't quite figure out how to work that. So we basically set it when we would arrive in the morning, usually turn it up. Last person to leave that night would turn it down so they could sleep comfortably. And this was a constant battle I had with my dad because he used to like to run the gas fireplace we had. That was kind of his favorite thing. Well, the thermostat was on the wall facing the fireplace. And so you could get that firm thermostat kicking on the air conditioning in the summer, whatever the case might be, because the fireplace was heating it up. But then the rest of the house would be ice cold. So these are just kind of things we had to figure out over time. Like I said, we did grab bars, we did ramps, we had an adjustable bed, we got some lift recliner chairs for them so they could safely stand up. Late in the game, we had to do some door alarms because in the middle of the night, my mom would get up and tell my dad she was leaving, or sometimes she wouldn't tell him. And then a couple of times the neighbors fortunately saw her walking down the street in the evening and grabbed her. And she was insisting that they take her home, or they would take her back to our house. She would say that's not her home. So this is how dementia kind of works. It can put a person in unsafe situations because they wander. Removing the car keys from the home, we had to do that multiple times because my dad kept putting my mom behind the wheel of his truck so she could drive. Our best attempts at finding all the keys, it took a long time. We did do shower chairs. Just having the shower chair and a detachable shower head. It's amazing how well you can safely shower someone with just a detachable shower head and a shower chair. I always tell people, if you walk away from this talk with one thing that you're going to do, put a detachable shower head in that shower and get a shower chair. You also have what are known as slide over shower benches where the person can sit outside the shower, because typically we're dealing with bathtubs that have a pretty high lip on them. You can have that person sit there, you just slowly slide them over. It has like a track, you can get their feet in and then slide their body in. So you can shower them sitting on that, and then you can safely move them out with them ever having to stand and step over the bathtub. Medication containers, always keep those in a safe place. We want walkers available inside and outside the home, wheelchairs, canes, all those things. Loose carpets and throw rugs. Again, my dad is from the generation that you have throw rugs everywhere. You have a throw rug in front of the sink, around the toilet, and all kinds of different places. Those are the number one reason that people trip and fall. One of the number one reasons, because they catch a foot and they fall. Got rid of all of those, okay? Every one of them I got rid of. Plus, over time, couches can sink, and so a person sitting very deeply into the couch, you want a person to be able to safely sit up higher, because the deeper they are, the harder it is for them to stand up. And so that's another thing I learned right away. I've got to upgrade these couches that have been in my parents' house for decades, you know. You can do things like weighted utensils for people that have a tremor. You can get little food guards that you can attach to the plate. So if someone has a tremor, the weighted utensil kind of settles them from trembling, and then they can push their food against the guard, the wall on the plate, so they can more easily eat. You can do colored plates as well, so people recognize the food more easily. There's amplified phones that are available. We've got the life alert system, some of which have a fall detector. So if a person's wearing it and they fall, they don't even need to hit the alert. It will alert automatically. Safe return bracelets for somebody that wanders. It has a special number to call where that person will then call a relative and say, somebody found your mom or dad. You never want to have something that has their name and address on it, okay? Because unscrupulous actors, again, will find mom or dad and take them home and burglarize their home. So it has a toll-free number to call where that person will take the number at the other end of the line at the a call center and then call a family member to say, hey, someone has your mom or dad. And then nowadays it's nice because anything you would use as an Apple AirTag for luggage, they have devices like that. You can insert in shoes or belts, whatever the case might be, so you would know where your mom or dad is if they start to wander. There's also reminder devices for family voice recordings. We tried these. I don't know how successful we were with them. We basically had my voice on medication dispensing machine that would say, Mom, it's time for your medications. And then the medications would drop into a little cup. And I don't know if it really worked very well because you get to a point where they're not remembering what they're supposed to do and the commands aren't really relevant to them anymore. They have to be shown what to do rather than told what to do. So we kind of failed at that. And then there's robotic pets, robotic babies. I know very late in life, my mom found an old doll from one of our siblings in a closet somewhere, and she used to carry that around with her. Sometimes she would call 911 and said, oh, the baby's sick, I need help, things like that. But it did provide her some level of comfort. So we have those available as well for folks. Any comments on anything?
I would just say with the medications, I didn't know before I was on this journey with my mom that there's a lot of different options for pill containers. You can get ones that, lock, that have an alarm that goes off when it's time for them to take their medication. There's even some subscription services through some of these like Life Alert type situations where they will call your loved one, when it's time for them to take their medication and tell them, and it coincides with, the locking alarmed pill dispenser. So there's a lot of different options for what might work for your loved one.
Absolutely. And like I said, that Alzheimer's store has some really amazing stuff. Just really interesting locks you can put on the door that are easily undone for safety, but that a person with dementia can't quite figure out. Some of them look at the locks like the locks you might find in a hotel room where you have to kind of turn the paddle around, but people with dementia have a great deal of difficulty figuring those out. So that's one way to keep a person safe in a home, for example. They have other things like they've got an actual, it's almost like a poster you put on a door that looks like a bookshelf. So the person won't think that's a door and try to leave. They'll just think it's another piece of the furniture. They've got a device you can attach to a faucet that actually has like a stick hanging down, and you leave the faucet on basically, but then you push the stick to one side to get the water to come out. So you can never really flood it out unless the person sits there and holds the stick to one side. So there's a lot of things that typically happen. My mom ended up flooding out the bathroom near their master bedroom, I remember. And it was one of those things where you always have to be aware that your victories can be very short-lived when dealing with someone with dementia, because she wouldn't wear an overnight adult diaper, but she would often wet herself overnight. So we finally got her to wear a diaper. My sister got her set up for bed, left the house. I came the next morning. Well, she had taken the diaper off and tried to flush it down the toilet. And of course, the whole bathroom flooded out. So we had a moment of victory there where we had her wearing the diaper, only to find out, well, she took the diaper off and flooded out the toilet. So that's the kind of stuff you deal with when someone with dementia. Short-lived victories sometimes. So health and safety tips for caregivers, first aid classes, fundamentals of caregiving classes. Those are offered at different places around the county. Those can also be done virtually. It's typically 20 hours, and that's the fundamentals class that we use to certify people for professionally to be CNA level caregivers. Back and leg and arm supports. We hire private caregivers for our parents into the home. We've got respite care programs through family caregiver support. There's also an adult day health program. Unfortunately, it's all the way in downtown Tacoma. We also have a multi-care PACE program, which is like adult day health, but again, that's all the way over in South Tacoma. We always encourage caregivers to do some relaxation techniques for yoga, meditation, aromatherapy, all of those things. I know when I was in the depths of caregiving for my mom and dad both, there was a lot of anger I carried around with me, a lot of resentment. I definitely was not at my best at all times, you know. I started to become much more aggressive when I needed to get things done. And sometimes you just do have to be that way. You know, if you're constantly caring for someone else and you're not getting the answers you need, you start to get very aggressive, but you carry that kind of aggressive energy around with you and it's not healthy. So in hindsight, I wish I had done more of this relaxation stuff to kind of dispel some of that negative energy I was always carrying with me.
I think too, this is where like caregiver support groups can be incredibly helpful. Like Matt, when my mom was in early stages and she was very resistant, she would not talk about it at all. She would not acknowledge that anything was wrong. And so then I became the bad guy, you know, if I would try to do something, and it was very hard to not be frustrated. And I found through alz.org, I found a local dementia caregiver support group that was designed for adult children caring for a parent. And that just normalizing what I was going through made such a difference for me in my whole role as a caregiver and going forward. There's regular caregiver support groups for spouses. I know I think the Bonnie Lake Senior Center has one on, I want to say it's the third Thursday of every month. There's one through Multi-Care. There's different programs, but I really encourage you to reach out to a caregiver support group if you're in that role, because it can just be incredibly helpful in getting you through it, whether it's through practical tips or just, again, that sense of knowing you're not alone on this journey.
Absolutely. That word normalizing is really important, because I think people get very isolated in the care they're providing and think, oh, no one will understand what I'm experiencing. And then you find out a lot of people in your neighborhood, in your church, are going through the exact same thing. So you go to that support group and it does really make you feel like, okay, this is someone I can share with who's also going through it. And it might have some practical tips that I can use and understands how I'm feeling emotionally, the sadness, the anxiety, the anger, all those things, because they're going through it as well. All right, necessary documents. We always want to make sure that in place long before they're needed, because again, the person cannot be ill or injured when they're doing the power of attorney form. So this comes up a lot. Families will call us on Monday at work at our office and say, Mom had a stroke over the weekend. How do we set up a power of attorney for her? Well, if Mom's unconscious or stroke affected in that moment, you can't do a power of attorney, because the person signing the power of attorney, it's understood under the guidelines that the state's established that the person understands what they're signing, okay? So what we did in our family is we set up a family trust, because there was a lot of retail rental properties in the family. Not everybody needs to do that, but as part of that, we set up the power of attorney forms. We set those up in 2012. Mom signed them, Dad signed them. Also had the healthcare and financial, we had the advanced directive living will, all of that stuff in place. Last will and testament in place. And then we didn't use the power of attorney forms for probably 6-7 years. So they just went into a cabinet and that was that. And then when we needed them, I knew where they were. The attorney's office had a copy. There was a copy at my parents' house as well. So long before they're needed is when you want to set these up. Okay, because in the state of Washington, once you have those documents in place, you're in pretty good shape in directing care, financial decisions, end-of-life decisions, all those things if you need to. The post form is known as a physician's order for life-sustaining treatment. Anymore, most doctor's office will talk with you about getting these done. And again, that's a discussion between the doctor and the patient. The doctor has to provide that form. You can't have anybody provide that. It has to be provided by the doctor, and he'll go ahead and sign off on that you had discussed with the doctor, had discussed with the patient issues related to extraordinary measures in terms of end-of-life situations like CPR, like artificial hydration, nutrition, all those things. Advanced directive kind of acts in that same way, but it gives a wider script for your power of attorney to follow. It could have things like, if I'm in a terminal situation, I want a certain type of music playing, or I want to make sure that there's a certain type of bedspread on my bed, whatever the case might be. But it also talks about things like, do I want artificial hydration, nutrition, breathing machines, all these different things to keep me alive if I'm in a terminal end-of-life condition. And then last will and testament, that's for after the person dies to settle their estate. And then burial and cremation plans, so get those set up ahead of time as well. My view is all of this should be discussed within the family So everybody's aware of what the plan is. I've heard other folks, even elder law attorneys, who say, no, don't do it that way, wait. I don't see the point in waiting. Anybody can get ill or injured and die this next weekend, right? So to say that there's a later time when it's better, you definitely want to get these set up early. And in my view, everybody should know about it. And I'll just give one example, and maybe Jen can chime in. Burial and cremation plans. So I'm a cradle Catholic, as were my parents. Forever, since I grew up, the Catholic Church did not approve of cremation. And then recently, the last 20 years, I think they decided that you could get cremated as long as your remains are held in a vessel and buried like a body. So great. I never dreamed my parents would want to do this, but they decided they wanted to do it. And so we set up the cremation plans with, I think it was Morley Mellinger Funeral Home. So we had them all ready. And then we discussed the whole thing with my family. Oh, mom and dad had decided. Well, I had one sibling was like, oh my gosh, it's sacrilege. The church, it's blasphemy, it's this or that. I'm like, she's never stepped into a church in her whole life, and she's trying to tell me about Catholic doctrine, but anyway, that's an aside. Turns out I took her to the church and said, okay, we met with the pastoral counselor, and she said, no, this is perfectly acceptable. In fact, there's Catholic cemeteries do now bury cremains in caskets in the Catholic cemetery, so it's fully acceptable. So having that discussion before they died made that period when we were planning for their funerals a lot easier, because you don't want to have huge fights going on in these end of life or past life situations. Any comments on that, Jen?
Yeah, I mean, again, just trying to have that conversation ahead of time.
Yeah.
Again, my mom wouldn't have that conversation. And so when we moved her out of her home and I started taking, checking her mail and things like that, she would get all these things from the Neptune Society. And I had to call them and say, does my mom have some kind of a burial plan with you or cremation plan with you? Because she won't tell us. And it turned out they were just marketing to her. So I was like, okay, please take her off your list. But it's hard to navigate that space when you don't know what their wishes are. So trying to have those conversations in any way you can is huge.
Any comments on that? Again, my view is if the documents are prepared in advance, that's the opportunity to have that family discussion, and it's sad. I know it's difficult because we deal with a lot of seniors that don't have close family or don't have close, trustworthy family. And I actually had a woman the other day when I was telling this part of my view of it. Again, this is my view. You might get a different view from other professionals talking about this, where she said, well, my niece is my power of attorney and we've already got the documents set up, but I don't know how much I want to tell her about that. And I said, well, if she's on the document and you trust her enough to be on the document, then you really need to have these discussions started about what you want to have happen. I personally wouldn't want someone listing my name on a document that I don't know anything about, right? You want to make sure you're part of that discussion. So again, that's my view. Other folks might view it differently, but that's my view.
And that everybody involved has a copy.
Absolutely, because in the state of Washington, these copies are as good as the originals under the statute, meaning that if you had an original at home, you made a copy and you brought it to the bank, that's good enough. And so this is why I suggest that you do have an attorney help you formulate the documents. You don't have to, you can find them online. But having an attorney formulate the documents and be part of the development of the documents, to me, gives you that extra voice you might need in situations where someone's questioning the validity of the document. So, and that can happen through the Bar Association. Tacoma Pierce County Bar Association has a senior citizen wills and trust panel of attorneys across the county who have agreed to accept a low rate to set up powers of attorney, living wills, and last will and testament, all as part of one big package. And it doesn't cost a whole lot. It's only a few $100s to put all of that together. So that's one way you can have some attorney backup if some issues come up with the documents. Any comments on that? Questions? Yes.
Well, we have the living trust.
Right.
We have all of that, and both our adult children are aware of it and seen it. Only thing we haven't done is the burial and cremation plans. I mean, my husband has been willing enough to say, I want to be cremated and taken to the four corners of Washington State,
Yeah.
But as far as it's okay, where do we want to go? And how do we want to set this up? That I haven't been able to nudge him in that direction just yet.
Yeah, so that's a perfect example. That's something you might
Yeah.
put even into the living will as part of that package to say, okay, the burial cremation plan is held by this funeral home. And once cremated, we would like the ashes to be dispensed in some location or something. So yeah, that would definitely be something you can put in there. So good work on getting everything else set up. That's great. That's great.
We actually, when my mother-in-law passed, she traveled. We took her back when they had film, the little film canisters.
Yeah.
And we would put little bits of her. And she's been just everywhere.
Oh my gosh.
Oh, that's
so
neat.
Sweet.
And it's
That's so
just,
cool.
yeah.
Oh, that's
It's been all
awesome.
over
That's
the
great.
place.
Wow, way to go. That's really awesome. Yeah. Yeah, my wife was looking into something she got a notice of about where there's like an environmental process where they'll do the cremation.
You can be composted.
That's right.
Yeah,
composting.
yeah, you
that's
can be
what it was. I was
composted.
trying to remember what it was. Yeah, so that's she was looking into that.
Yeah, over on the peninsula, my daughter looked it up. There's actually a forest over there somewhere. I don't know where, but she found it online. And there's a forest over there where they will take you and they'll literally bury you out there in the woods.
Yeah.
Yeah, it's kind of cool.
And there's groups like, I know there's one in King County where you go into this pod and they basically add soil and they compost you, and you end up with a bunch of bags of soil to share with family or
awesome.
take up into the woods yourself or whatever.
Yeah, there's a lot more diverse options now than there used to be in that.
Yep.
So good. Yeah, that's basically the lesson. Get them done early. Make sure the relevant people involved have the information. And I know everybody worries about there's going to be fights involved and disputes, and those fights are going to happen earlier or they're going to happen later after you die. My view is try to get them done earlier rather than later. It's tough enough for siblings to be planning how to manage your estate after you're gone without everybody fighting about it. And even with the best laid plans, there still might be fights. But it's better to have stuff written down in a document that has directions on how you wanted things to happen. Okay, more tips. We talked about stress reduction techniques, proper rest and nutrition, regular exercise. This one's really important, taking time off without feeling guilty. Having those opportunities where you either have sibling support, other friend support, or professional support involved, where you can take a break from the daily interventions that you have to do with the family member. Sometimes it works out, sometimes it doesn't. I remember I had a weekend planned with my wife. We were going to Bainbridge Island, and the siblings assured me they would take care of things. Well, there was an incident with my mom. I remember on that Sunday, we were staying Saturday night, Sunday night into Monday, because there was a Sunday event we were doing at Bainbridge Island. And my phone started to blow up. Mom's in trouble, mom's in trouble. Couldn't give me one weekend away, So setting them up, making sure things happen, try again if it fails the first time, but having those away times is really important with sibling help. Any comments on that, Jen?
I think just especially your line of don't feel guilty. You hear on the airplane, you got to put your oxygen mask on yourself first. I mean, you are in a better place to care for your loved one when you do take time for yourself. And so you just gotta take that guilt out of it and just know that you're showing up better for them by taking care of yourself.
And there's really some great books that are well written that talk about this whole caregiving journey that you're on. A lot of them, some are written specifically for folks that might have had dementia, they're written about their mom, others are written about a husband or wife. There's a great documentary that you can find called Wine, Women, and Dementia. It's all about women gathering and telling their stories of care they're providing to their husbands around a glass of wine. It's really an interesting story. So that's another one I think you can find online for free. I think you can find that. Have you seen that?
I have. It's good.
Yeah, it's good. Seek and accept support of others. We talked about support groups, supportive counseling through family, friend, pastor. Recognize and own those feelings you're having. I went through that whole gamut of feelings, still have some residual feelings of resentment and sorrow and still some second guessing on things I could have done better. What I always try to tell people who ask me about that feeling is you did the choices and made the decisions you did at the time to take care of them. You were the decision maker, you made the decision. Now looking back, you could say, with the proper knowledge, I would have made the perfect decision, but you're years removed from that moment. So don't go back and berate that earlier self and say, he could have done it better, you did as well as you could in that time, in that moment, with the situation you had. And that's all you can do. Try to release yourself from any second guessing, because that'll just drive you crazy. Change the negative ways you're viewing things. Again, look for those small victories and the happiness that might be seen in some of the interventions you have. I mean, I kind of had to change my whole view of my mom from being this very quiet, polite woman to be kind of a loud, profane, very blunt woman. And so you just kind of had to ride that wave, you know, because if you said, oh my gosh, my heavens, what are you saying, Mom? He's just like, that's silly, you know. She's changed a bit. She didn't want to make that change. It was the dementia, the strokes, whatever. And this is who she is now. So have a laugh about it now and then. Don't take it personally. And then we mentioned, like we mentioned, the caregiver support group is really important. Reminder on vaccinations. We're going into cold and flu season. Medicare does approve all the CDC recommended vaccines covered at 100%. So no co-pays for flu, COVID boosters, RSV, shingles, pneumonia, tetanus, hepatitis. I think all of those are covered at 100%. So make sure you get those done, because as we get older, any kind of illness response, inflammatory response, especially pneumonia, shingles, can really be damaging both physically and mentally. I read a study recently that folks who took the shingles vaccine and therefore avoided shingles had like a 25% lower incidence of dementia in this long-term study. So shingles late in life can really be physically and mentally damaging. And that shingles vaccine is known to be the sanitary vaccine, in that it will typically keep you from incurring the illness. So think about getting that one since it's 100% covered now. Oh, I just said that. I just said it myself. So yeah, shingles, influenza, pneumonia, RSV, tetanus, COVID-19, all those. Plus, COVID was circulating again here recently. I got sick with it back last couple of weeks in August. My wife got sick. We talked to friends up here in Lake Taps. They were both sick. Talked to a friend in Spokane. She got so sick that it became pneumonia and was in the hospital a couple of weeks. So make sure you get those vaccines. It seems to circulate this time of year. Then there's another burst, usually around the holidays, I think, another into the spring. My wife, both times she's had it a few years ago, and this time she talked to the doctor and was prescribed Paxlovid. This is an antiviral medication if you have COVID. You start taking it right early after you test positive. You take, I think, 3 in the morning, 3 in the evening for 5 days. And both times it completely cleared her of the virus by the end of the 5 days. And she's got some vulnerabilities because she's type 1 diabetic. So I would recommend, if you're testing at home, you test positive, call your doctor, say, I want the Paxlovid. And at least in my wife's case, it did clear her pretty quickly. Now, it does have a terrible side effect that it gives you this horrible metallic taste in your mouth, and so everything you eat seems to taste metallic. But then again, on COVID, you're not going to be super hungry anyway, because sometimes your taste goes away anyway. So think about taking that Paxlovid if you test positive for COVID. Okay, so help with Medicare questions. This comes up a lot this time of year. You can talk to Sheba. This is a free service through the Office of Insurance Commissioner, the statewide health insurance benefits advisor. You can call their 1-800 number. They have a local office in Tacoma. They will take care of all the questions you might have over the phone. They can email or US mail you information about the plan you're in now, choices you might want to make into 2026. Great service that the state provides. We have a very robust set of volunteers that help with that. They go through like 40 hours of training, and they do a lot of on-the-job training as volunteers before they're ready to help you out. So they can definitely help you out. Legal documents, we mentioned powers of attorney, living will, advanced living will, last will and testament. If you choose to avoid dealing with an attorney, you can go on this website, and all of those things I just mentioned are available. The documents, the Q&A are all available on this website. So you can print out powers of attorney forms, you can print out living will forms. I think they have instructions on establishing a last will and testament. I don't think they actually have a form for it. And so this website is invaluable. We use it all the time when we're referencing this. People will call us and ask for copies of this kind of stuff. We'll just print it out and send it to them. So feel free to browse on there. There's great Q&A, question and answers on there about the documents and how they work, how to use them, all that stuff. Very helpful. Washington Lionel. Plus, they have a lot of planning ahead summaries on there for Alzheimer's, dementia, powers of attorney I mentioned, death planning. I think they have something like 100 things you need to know about planning for a death, in terms of things you need to have ready. There's a lot of information about Medicare, Medicaid, different programs, what they pay for. Really, really useful website. I really encourage you to go on there and just do a search on there of different topics you have interest in. Just find the information you might need. Caregiver support programs that we offer through the county. These are programs that actually put care into the home for somebody who might need it. So the biggest one we have is the COPES program, but that's the most difficult to qualify for. It has pretty strict income and asset rules to qualify. Little more generous asset and income rules on the TSOA program. And then this FCSP, that's the Family Caregiver Support Program. We mostly have husbands and wives on that. Sometimes we have adult children living with parents where they're acting as the family caregiver. This is not a Medicaid program, so it's only based on income. Typically, a husband and wife, their income can be as high as $6,000 a month, and they'll have no cost to get the help in that program. We don't look at any assets that they might have. And it typically puts 24 hours a month of relief help into the home. There's some housework and errands that goes with that, some medical equipment, there's some caregiver counseling that goes with that. We've got probably 200-300 couples on that program. It's really just based on the family caregiver, the husband or wife calling us and saying, hey, I'm taking care of my husband. He's had a stroke, he's ill, he's got cancer, he's got dementia, whatever. He doesn't need a lot of help. I don't need anyone to come in and get him dressed or bathed, but I just need someone to be here every Tuesday because that's when I go to my women's group or that's when I go to my doctor's appointment. So you can set it up 24 hours a month. You can set up every Tuesday, Thursday, each week that the caregiver shows up at your house at 1 o'clock. They're going to stay till 4 o'clock. And that gives you that break to go and do the things you need to do and know that there's a trained professional at your home. And they might just be watching TV. They might be redirecting that person. They might be having lunch with them. But it's a really useful program. And again, it's just based upon the family caregiver calling us and saying, I need some help taking care of my husband, wife, whatever the case might be. Okay, other support programs for family caregivers. We have the donor closet. Again, this is over in Tacoma, but it has all kinds of low-cost secondhand medical equipment, walkers, wheelchairs, incontinence supplies. Get it very cheaply there. It's all been refurbished, inspected, sanitized, all that stuff. We have the Alzheimer's store we mentioned, has all kinds of devices for someone with memory loss or confusion. Washington Connection, that's a website where you can apply for programs easily, whether it's basic food, care in the home, whatever the case might be, or you can call us. The Tualta program is really nice. Tualta is all about YouTube videos that you can watch anywhere from 3 minutes to 30 minutes long on every topic under the sun about caregiving. How to safely shower someone. What does medication management look like? How do you redirect someone that's angry? It's all on that Tualta site. It's incredibly valuable, completely free. You do typically have to set up an account with them when you go on there so they can email you alerts and things like that, but it's a great resource. The Dementia Legal Planning Project, again, if you don't want to go through an attorney, they will come out and set up powers of attorney and living wills for you at no charge. The trick with them is that they don't notarize the documents, so you would still have to get a notary in place, which is why if you're trying to put the package together, I would recommend you probably want to talk to the Bar Association if you want to have an attorney involved. Our Veterans Program, there are some programs for home care under the Veterans Services. We have a Veterans Program in our county office that can help guide us with that. And then in the future, or for anyone in the room who's actively working, like Jen and I are, since July of 2023, the WACARES Fund has been taking money out of your check every week or 2 weeks to fund this care program. And if you were born before 1968, you'll be fully eligible next July to tap into the benefit, which is going to be $36,500 to pay for your long-term care needs. The unique thing about that WACARES is they're actually apparently going to pay husbands or wives to be caregivers. No other program does that, but apparently this program is going to do that. So this is only for people that are actively working, not people that are already out of the workforce. But this is that project that the state of Washington put together, one of its kind in the country, to see if we can locally fund long-term care to a certain extent for folks later in life if they become ill or injured. More information, my office, 798-4600. Everything I talked about today, we can give you some guidance or direct service on, whether it's it's information on assistive devices, whether it's information on support groups, on information on caregiver support programs in the home, give us a call or go on our website. Plus, we have a public meeting events calendar where we put things like wellness fairs that are upcoming in there, where we put information about this is a long-term care planning workshop that's going to be happening at Pierce College Puyallup this coming Saturday. So information like that you can find on our public meeting and events calendar. If you have someone in a care facility or going into a care facility and you have questions about the types of care, the quality of care, you can call us. Our Ombudsman service is all about going out into those facilities, doing quality of inspections, doing troubleshooting, anything that might happen. So if you got a friend or neighbor that you know is in a care facility and it doesn't seem like they're getting the care they should, please call us and we'll investigate that for you. And then just a sampling of what we talked about on caregiver support. So close by at Multi-Care Good Samaritan, downtown Puyallup, they have a caregiver support group that meets the first Wednesday of every month. Brian Holtfeld's the contact there. But there's other ones they sponsor, plus Franciscan does. The Alzheimer's Association has stuff, both in person and remote, that you can do support as well. I believe, like Jen was saying, Bonnie Lake, I believe Sumner's got a support group for caregivers as well, Sumner Senior Center. So again, look there, call us, we'll help find one for you. And again, those are really valuable to attend those to get some relief. Plus, upcoming, we just had our Alzheimer's Dementia Conference out in Parkland. That was a free conference the county sponsors with Healthcare Providers Council. We're probably going to be doing one in March, known as a Guardianship Summit, where we talk a lot about these care planning with regards to legal documents. It's relevant to anybody that's wondering how to properly do long-term care planning for a family member. Plus, in the spring, hopefully, we'll have the Aging Expo again. That's at Pierce College Puyallup. That's all about health and wellness as you grow older and planning to stay healthy and well as you get older. So there's a lot going on that you can find at our Pierce ADRC.org website under the public meeting and events calendar. I think that is it.
I was trying to find the at the Bonnie Lake Senior Center, the caregiver support group there, to see what day of the week it is, and I'm not seeing it right offhand. But you can call them, and they'll let you know when it is.
Yeah, oftentimes they'll pop up. We don't know about them until pretty late in the process, so that's good to know that one there. The one in Sumner has grown to be a pretty regularly supported support group. I think I'm thinking the YMCA down in Sumner might have some programs for older adults as well.
Okay.
So yeah, possibilities there. So yes, any questions, comments?
Any questions online? All right. Well, thank you,
for being here.
Matt.
If everybody signed up, they'll be able to get the PowerPoint, right?
Yeah, we're going to upload it to the website.
That's
So
right.
I need to do you have a copy? Because I don't know that you sent me a copy of the
So,
PowerPoint.
yeah,
I mean, you sent me this,
this-
but in terms of the slides, like a lot of times you have a handout that's got,
I
maybe
didn't bring them.
you didn't bring them. Okay, I'll form it into a handout and upload it to the website. Okay, good.
All right, well, thanks for being here. Appreciate it. We got some other resources here. If you folks want to grab them on the way out. We've got one more in this series of